When it comes to infections on the local health front, it seems the youngest patients are the most affected right now. And the nurse practitioners at CVS Minute Clinic say it's important to remember that one of the best means of preventing the infection from spreading is to stay home. Here's this week's What's Going Around report. In South San Diego, Kasia Lalacata in Chula Vista has seen several children with impetigo. This is a skin infection, usually caused by a staph bacteria. Symptoms include red sores around the nose or mouth and a formation of honeycomb-like crusts. That trend continues in North San Diego, where Gina Marcone in La Jolla points out impetigo is extremely contagious. It's spread by direct contact. Treatment includes warm compresses to remove the crusts and antibiotic ointment. If the symptoms do not improve in a week, the patient may need antibiotics. In East San Diego, another infection targeting young patients. Kate Fitzgerald in El Cajon has seen a number of children with CROUP. This is a common illness that is characterized by a few key symptoms, including a barking cough that is worse at night, fever, decreased appetite, and a hoarse voice. CROUP typically clears on its own, but if the child has difficulty breathing, they should get immediate medical attention. And in Central San Diego, Gretchen Broman at Claremont has seen several patients suffering through the flu infection. Symptoms include a sudden fever, chills, body aches, and fatigue, along with a sore throat, congestion, and a cough. As of October 30th, there have been 362 confirmed cases in San Diego, including 2 flu-related deaths. If you think you are infected, see your healthcare provider within 48 hours of onset to begin antiviral medication. Otherwise, prevention is key, and that means a flu shot. And that does it for this week's What's Going Around.